Health Coverage, UHC, holds the key to unlocking the door of significant improvement in the health status of Nigerians. UHC is about people having access to the healthcare services they need without suffering financial hardship in paying for them. Most countries in the world are now striving to achieve UHC. As at early 2013, about 30 low and middle income countries are implementing programs that aim to advance the transition to universal health coverage, and many other low and middle income countries are considering launching similar programs. Indeed, low to middle income countries like Brazil, China, Ecuador, Turkey, Indonesia, Ghana, Rwanda, Morocco, Sierra Leone and Thailand are among those that have either taken steps or are currently taking steps to reform their health systems to move closer to universal coverage. UHC was placed on the global agenda when the 58th World Health Assembly in 2005 adopted a resolution calling on member states to develop their health systems. In that same year, the National Health Insurance Scheme (NHIS) was launched as a key national strategy for achieving UHC and to address financial risk protection. This is explicitly captured in NHIS' objective to ensure that every Nigerian has access to good healthcare services as contained in the NHIS Act. Although NHIS, with its various programs, is the major federal government key financing mechanism for removing financial barriers to accessing health services, there are also other complementary financing options at the federal and state levels that also help to improve financial access to services. These programs include health equity funds, community-based health insurance, fee exemption schemes, conditional and non-conditional cash transfers, voucher schemes, among other programs. Those covered are mostly civil servants and the former private sector, leaving out the most vulnerable segments of the population who have higher disease burdens, lower incomes, and are in most need of protection. To address physical access, state ministries of health and the National Primary Healthcare Development Agency have invested in refurbishment and construction of primary and secondary healthcare facilities, while the Federal Ministry of Health had dedicated most of its investments in this area to tertiary healthcare development. In 2011, the Federal Ministry of Health estimated a total of 34,173 health facilities in Nigeria, of which 88.1% are primary healthcare facilities, 11.7% secondary, and 0.2% tertiary. This provides roughly one health facility for every 6,000 Nigerians, with wide variations across states, urban and rural areas. Although 60% of Nigerians receive care from private providers, public-private partnerships are still weak, and the role of the private sector in providing care to those in lower income groups and hard-to-reach areas is yet to be properly harnessed. There have also been efforts to improve access to quality care, medicines, and skilled human resources.
Almost to be crazy to enter bush. God is wonderful. She go for stand. Then they invite me to come, but I no go. So after that time now, before she come born.
Ogem dime na bia here na ana treatment hana kuna ilete nkoma. When sombo hana ilete nkoma. Ya ka hana try wo go la ko. Hana try bo mo chapara. Adi ha wala na hai. Until ha odan be efensi ha podrai. So eba ha kai nozi. I
had a CS delivery operation. I was operated on, so, and I was told that it's free, and it's free since I gave birth to my baby. I've not paid a dime, and I'm told that I will also leave this hospital, be discharged without collecting a dime from me.
And I'm making abali free treatment. Like oto men operation no go. Ajimi no na private hospital. E woni ka gara ala before ma lota hospital. Etu ihe ana hemena yebe dem.
The minimum package of care defined in the National Strategic Health Development Plan sought to ensure the availability of a set of high-impact health interventions and services at each level of the national healthcare delivery system. The Saving 1 Million Lives initiative is providing a platform to improve results and outcome-based programming by helping shape strategy and improve performance management and coordination of existing health programs. The SHOPE Maternal and Child Health Program is a nationwide initiative that is helping to increase access to skilled human resources by scaling up the midwife service scheme as well as availability of quality, evidence-based, high-impact life-saving commodities, medicines and supplies. Since 2011, Nigeria has made a commitment to ensure universal access to contraceptive commodities at all levels and is investing a total contributory sum of $8 million annually. To date, more than 10,000 healthcare workers have been retrained and re-engaged to provide services in more than 600 participating health facilities. These facilities are also well stocked with and have not reported any stock out of essential commodities over the same period. However, despite these efforts, if Nigeria is to attain universal health coverage, as well as its goal of achieving 30% coverage with appropriate schemes for populations in the lowest 2 quintiles by 2015, as reflected in the NSHDP, the levels of coverage for access to healthcare services and financial risk protection need to be significantly improved at all levels. The Presidential Summit on Universal Health Coverage therefore seeks to produce a declaration on universal health coverage in Nigeria, signed by Mr. President and all the governors, committing to fast-track actions towards UHC and achieve 30% prepayment scheme coverage by 2015. President Goodluck Jonathan, in his New Year message on January 1, 2014, had reaffirmed the commitment of his administration to achieve universal health coverage in Nigeria. He said, "In this our centenary year, we will continue our efforts through the Saving 1 Million Lives initiative to strengthen primary healthcare services. We will scale up interventions in reproductive, maternal, newborn and child health, nutrition, routine immunization, HIV/AIDS, malaria elimination, tuberculosis, neglected tropical diseases, and non-communicable diseases. We will pay greater attention to the provision of universal health coverage. Besides the implementation of new initiatives, such as my comprehensive response plan for HIV and AIDS, we shall continue to collaborate with global health partners to deliver our health sector transformation agenda." The Presidential Summit on Universal Health Coverage will also seek to secure the commitment of other political levels, including governors, the local government chairman, the National Assembly, as well as different ministries. Another objective of the Presidential Summit on Universal Health Coverage is the commitment by all levels of government to increase government funding for health, significantly increase coverage of financial risk protection schemes, especially for the poor and vulnerable groups, as well as develop and institutionalize mechanisms that will improve efficiency in utilization of available funds. It is also a platform for mass mobilization of Nigerians for health. The summit will lead to the creation of the UHC movement in Nigeria at the local government area, state and federal levels. This will help in the mobilization and mainstreaming of health in all sectors. Health in all policies.
2015, which is next year, that at least minimum of 30% of Nigerians should be enjoying one form of health insurance policy or the other. So this is the beginning of a journey.
We have identified what are the major causes of hindrance to attainment of universal access, the challenges that have been identified, and they will be addressed fairly.
No, the resources are limited. Therefore, it involves everybody.
So this year, we are going to enroll 24 million primary school pupils nationwide to join the scheme. and we're going to finance this through cross-subsidization.
This is a new way, and I'm sure at the end of this summit, Nigerians will be smiling and be very happy that Mr. President has turned around the health system.
Universal health coverage, vehicle for sustainable growth and development.